Friends and colleagues, good afternoon. Thank you for being with us today. And I know that we're quite heavy in this program on immunisation, particularly adult immunisation, but it's important, isn't it, in the context of healthy ageing. I'm delighted to be the moderator for this afternoon session, which is sponsored by GSK. The IFA, as you've heard over the last couple of days, regards our partnership with industry as very important, because we believe that at the table to influence policy must be government, non-government, academic, industry and older people. So we're very proud today to have this GSK-sponsored symposium entitled Making Immunisation Coverage Change Really Happen: Measurement, Media and Movement. We have 3 speakers today. The first speaker will be Catherine Keogh, GSK Canada. Welcome, Catherine, from our home in Toronto.
That's right.
Thank you.
Jane. Well, you know what's funny is this isn't quite my whole title. It's Senior Public Health Vaccines Market Access Manager, but I just put that. Just seemed a lot. So thank you guys for having me today. This is just really a talk about, I'm just going to put this down a bit, just how to actually mobilize the policy work that we do together, and just kind of giving tangible examples around, you know, where we really see traction, and truly it's where we all kind of come together to kind of mobilize our forces together. There we go. So this is basically the problem with not just Canada, but every country probably, is that access to vaccines should be a right, and for many Canadians and people globally, it's just only a privilege, and oftentimes it depends on where your postal code is or where your zip code is as to what is funded and available for you and accessible for you. So I think I'm missing a couple slides, Jane, but that's okay. I can speak to them. So one of the pieces that I wanted to highlight was really around the funding that goes into vaccination, and the percentage of funding that is spent on vaccination is absolutely dismal. It's 0.15% of the overall health spend in Canada, and it works out to, I think, 333 million out of a 250 billion, and I'm making up numbers because it's on a slide somewhere. So it's a very dismal amount of money that goes into vaccination, and what we are trying to see is, you know, just a little bit of understanding of the health system, so that there can be a little bit more, well, not a little bit more, but a lot more focus on prevention and finding equality in the silos in which governments spend their money on. So to Jane's point, really where we see policy wins and, you know, access for patients truly making a difference is when we combine all the efforts from NGOs and government, industry, academia, and policy groups and patients themselves. So a lot of times we have groups that have patient members like CanAge and CARP and the IFA. There's all just people within those organizations, and those people are the ones that really tell the story of why we need to make things available for patients.
So, Catherine, if you can just hold there and be flexible.
Sure.
Some of the slides were hidden, so we've made them live.
Perfect.
He's going to,
Oh, perfect.
to bring them back up.
Sounds perfect.
So
Well, then I can get to the more numbers,
exactly.
because I didn't memorize them.
So,
No, that. What's that?
Now you can practice your filibuster.
Yeah, exactly. No, that's fine. But I think the rest is fine too. Because really what I wanted to go through are some of the tangible examples of what what we've achieved, I think, together with, a lot of different organizations and just examples and tangible things that, we want to learn together and, make some traction. So, oh, perfect. This is one of them. Yeah, awesome. So yeah, so this is the one I was chatting about before. So when you look at the spending on routine vaccine procurement, so this is not necessarily the costs and the funds that go into the actual programming, so paying for nurses and things like that, but it's 0.15% of the total public sector spend. And when you have your total sector spend of $226 billion, and then even furthermore, you get into the public health spending. And this public health spending here it includes immunization, but it also includes a whole whack of other stuff too. So it just basically goes to show that prevention and immunization strategies are not prioritized, and we need to do more collectively to make governments understand that this is really important stuff that will achieve all the things that massive, almost 99% of spends go towards. We're preventing all that, right? So it's just, I think the fact that things are siloed in budgets is a massive issue that we need to correct with policymakers. So this is just a nice understanding of, the spends, vaccine procurement spends over the last number of years. And you'll see a dip in 2020, and that, a lot of it was when public health measures impacted people's, everyone was told to stay home, so people aren't going. We saw a real dip in routine immunization and a lot of policy, furthermore, focus after that to get people back to routine immunization. And then in 2021, that's including, some of that COVID vaccination spends. But we still have a gap in routine immunization uptake rates that we're still working with government to pull through and to get those people caught up. So this is a very busy slide, but basically what the story that it tells is that in Canada is a bit of a mess, right? And there's a lot of stuff happening, and we have federal stuff happening, and then we have provincial stuff happening. And with very few exceptions, vaccine procurement spends and policy is done at the provincial level, but a lot of the regulatory work is done at the federal level. So you end up having, a recommendation from NACI, which is Canadians NITAG, and NACI will make this recommendation, and then it will kind of go to across the provinces for the regional and provincial immunization committees to then make a recommendation on, and even those provincial recommendations don't 100% lead to the government deciding to fund it. So we've been working at GSK with all the provinces, and I'll give the shingles vaccine as an example. In some provinces, as soon as we launched the shingles vaccine, every provincial committee, advisory committee, and provincial public health team submitted proposals, budget submissions to government asking for funds to fund the shingles vaccine. And that vaccine was launched in 2018. And now we have about 12 programs, not all provincially funded programs, but we still have a ways to go. So it doesn't, these advisory committees, and it's great when you see that, but ultimately those budget requests are going alongside all these other requests, and it's just something that's clearly not prioritized enough. So, and then this is just a little bit more detail in Canada as to procurement and regional distribution of vaccines. If you have any questions about this, I'm happy to chat more about it. But we chatted about this one already, and just where the magic happens in policy is when we truly come together for joint aligned initiatives. And ultimately, I think where we all see success is when and we were just chatting about this earlier, is that, everyone, whether it's industry, academia, NGOs, government, if we truly are thinking about the patient, we're aligned, because if it's making more access points for patients to get their vaccination in a, easy, convenient way, we all agree on that. So it's like when we have these conversations with policymakers, we're kind of singing from the same song sheet. So it makes it at least more streamlined, even though it's an uphill battle, but at least, like I said, we're singing from the same song sheet. So it really makes a difference that it's not just GSK having conversations, it's not just IFA, it's a lot of times we do work collaboratively, joint letters, different things where we really try and, put momentum behind it in numbers where we start to see some cool stuff happen. So this is just a couple examples of, some advocacy wins recently, and just some stuff that we've accomplished in Canada. Number 4 there's a new shingles vaccine that was recently announced in Quebec, our second largest province in the country. And it's interesting, it's a shingles vaccine program for those 80 plus immune compromised people 18 and over. So obviously a lot of work to be done because the indication of the vaccine is down to 50. So we're starting 30 years higher than what the indication is, but it's a foot in the door, right? So every year, as budgets remain the same, we can hopefully add another cohort under it. So 79, 78, 77, and eventually, have more success down to maintaining that indication and the policy attached to that. So another, some interesting stuff that we're doing in Ontario, one of the biggest provinces in Canada, is we're working collectively with IFA and CanAge and a number of pharmacy advocacy groups, really to make vaccines, and especially adult vaccines, more accessible in pharmacy. And we've done some stuff on the, I want to say on the private side, but people that are either paying out of pocket or utilizing their private insurance. But there's still the publicly funded vaccines that are only available in your physician offices. And in Canada, I think in Canada in general, and probably throughout the world, primary care throughout COVID really is max capacity. So primary care physicians, they're not able to get patients in very easily. We've done a lot of survey work to really highlight the importance of the need for a solution here, because one of the surveys that we did recently was we found out that 10% of people don't have a primary care physician. And then because of COVID, because of, policies in physician offices, another 25% of people can't even access the physician that they do have. So we're looking at 35% of the population that has no option to get this vaccine that's available to them. So is it actually available to them? No, it's not. So we've been doing a lot of work, and just some of the initiatives that we're doing are joint letters to ministers and joint letters to the premiers in Ontario, and aligned to some different advocacy approaches through Twitter that really target those letters. And actually two of the letters that we did were, one of the main writers was LSO, which is Life Sciences Ontario, and the Chamber of Commerce in Ontario. So two organizations that have a lot of weight with government. So them being the lead on some of these initiatives, and actually doing some Twitter posts and very directed Twitter posts to government, it really makes the issue not just about us vaccine advocacy people, but people like organizations like the Chamber of Commerce or Life Sciences Ontario that can really take this to a higher level. And this, Laura, it will be here, I'm sure, at some point to speak more about the vaccine report card. So GSK funded the vaccine report card, I think the first year was 2020. I don't want to steal her thunder and talk too much about it, but this is a tool that we're really proud of, and it's something that a lot of the groups that we work together in collaboration with, a lot of us utilize this vaccine report card in a lot of the policy work that we do. It just, number one, it showcases, you know, very objectively where each province is at from, I guess, a prioritization of adult immunization. So it ranks, it gives basically a grade for awareness and education, for funding, and then for accessibility. So there, collectively, you're going to get a grade for each of those things for each vaccine that's recommended by NACI, which is the advisory committee in Canada. And, you know, when we show these things to, for instance, in Ontario generally gets a B, so not too bad. But then when we go in and have discussions, our big policy project with Ontario is increasing access in pharmacy. And when you drill down to the report in the access section, Ontario is getting an F for access. So it's like, you guys are doing pretty good. You're getting an A- for funding of vaccines, but people can't get them. So we need to figure out how we can get them. So this is just a really tangible way in which we can really articulate these discussions. And, you know, Laura will talk more about the methodology and whatnot that goes into this, but we're utilizing a lot of their own information when CanAge develops this report. So it ends up being, you know, oftentimes if you can utilize policymakers' words back at them when you have conversations, I think it's that much more impactful. So this is another thing, and, you know, the IFA was amazing, you know, when we did our first Shingles Awareness Week ever 2 years ago. This was something that really got this on the map, and the IFA was amazing, and we did a lot of really cool things together with respect to highlighting the importance of preventing shingles. And, you know, the IFA did a lot of, you know, webinars and targeted media and different panel discussions where I think one of the really cool wins, Jane was able to get the Minister of Seniors in Ontario to, you know, to take part in a panel discussion. And, you know, some of those wins are amazing, because then you can take that and bring it to government and be like, your Minister of Seniors is part of this discussion and wanting to see progress here. So it's really impactful. So this is a nice win. And over the years, another organization in Canada, the National Institute on Aging, NIA, they actually did a shingles white paper, so a policy paper, that's really, really well done, and it highlights the discrepancies and inequities across Canada. And that was, they launched that during Shingles Awareness Week, and, you know, to get some more buzz. I think one of the, you know, as I think more about things like Shingles Awareness Weeks and these initiatives, is that, you know, we have periods of time where there's really heightened noise in the environment. And I think one of the things that I'd love to strategize with our partners here is how we keep that noise high, you know, and it's almost like, as we're thinking about the year ahead and different things that, you know, we work with IFA on different things, and the NIA and CanAge and CARP, is like, how can we, like, you know, keep these things so that there's stuff coming out once a month or once every 2 months, so there's always something new in the environment that we can, you know, put in in policymakers' face, just to keep it, you know, top of mind. Because in the pharmacy space, in the pharmacy file, if we're not in there talking about it constantly, it's gone. Like, it's gone. They have a new fire to put out. So that, I think, is something I'd love to brainstorm with you, Jane, on. And then this is just some of the, you know, collaboration and partnership stuff that, you know, I spoke to some of the survey work that we did around access to primary care. Another survey that we funded through 19 to 0. 19 to 0 is one of Canada's bigger healthcare coalitions. We did a lot of work around what the preference for individuals are around pharmacy and where you'd like to access your vaccines. So there's some really cool stuff there. And we also partnered with NPAC, which is a national pharmacy advocacy group. They're called Neighborhood Pharmacy Association of Canada. And we worked on a campaign that was really focused at government. And the 1 in 4 there, what that means is that 1 in 4 Canadians, 1 in 4 adults actually, have missed a routine immunization during COVID. So all the more reason that we need to, not go back to the drawing board, but really make sure that these things are highlighted for policymakers. And the 1 in 4, that's something that, we really leveraged that campaign in our pharmacy work to just make sure that policymakers really understand how many people are not getting the routine immunizations that the government has every intention of funding. So that was a really successful campaign. And then I think the other thing I'll mention is number 3 here. So a few years ago, and Jane weighed into this, and so did CanAge and a number of other stakeholder groups. So Shingrix is GSK's shingles vaccine. It was, when it launched, it was a Schedule I vaccine, and in Canada, NAPRA is basically the national drug scheduling regulatory body. So they deemed Shingrix a Schedule I, and basically every vaccine is a Schedule I unless it has all or most provinces funding the vaccine. So during COVID, we only had about, probably 2 provinces that funded the vaccine. And then we had a few federal formularies that funded the vaccine. So we actually put together a really big advocacy effort with NAPRA. We did a full submission in order to reschedule the shingles vaccine because we were successful. So we actually were able to reschedule it to a Schedule II vaccine, which made it available for patients in pharmacy without the need for a physician prescription. So it just eliminated, and these are cash paying, so this isn't the publicly funded program, but for people that just want to go get their vaccine, it was a significant barrier that was alleviated. So that was a really cool win. And then lastly, I'll just speak to, we're working on the development of PAV, which is the Partnership for Adult Vaccination in Canada. So we're because of what we know in policy and making policy gains for patients, is that it really is a collective voice that will get the job done. So we're initiating this a Partnership for Adult Vaccination, and it's led by 19 to 0. The IFA is really interested in being a big part of this too, which is exciting. And we're looking to get a number of different stakeholder groups, not necessarily just groups that have always played in the immunization space, but groups that, physician groups or, patient groups like, the Lung Association, like different organizations that have big voices that, agree in principle to vaccines, but it's kind of, when you have a lot of these powerful groups together that align on the need to do this, you just have that much more impact. So that is in early stages. And then lastly, just to close, I think, from a Canada perspective, and probably a lot of countries are quite similar, what we could do better in Canada from a policy perspective, and these are all things that are being worked on by different, members of different teams and different organizations, is NACI. So our NITAG, it's, we chatted about this yesterday about more transparency and so on and so forth, similar to ACIP. And basically the recognition of global bodies. So if ACIP has put out this recommendation, why are we waiting for NACI to do it 8 months later? It just seems very redundant. So really leveraging work that has already been done to minimize redundancies. And then in terms of access, things like shortening timelines from recommendations to funding. This is because there's no actual system in Canada like there are for drugs. So for drugs, there's a I don't want to say well-defined, but a defined system in place for provinces to cover the cost of medications, and we don't have that in vaccines. So it ends up having to be this political, decision each time, which changes every 4 years, and, it could change more times than that when there's shuffle of cabinet and things like this. So more of a defined pathway. And then in terms of reimbursement, there's just, different pros and cons in terms of how public health can play its role, and then just federally versus provincial funding. If there was federal funding, and that's something that the coalition is going to be advocating for, to make it so it doesn't depend on where you live in Canada as to what is available for you for free. So these are all policy objectives that we have in the next couple and in the next couple years, and that's it. That's it for me. So I
think that we'll take a few questions from the floor, if that's okay. So Catherine, why don't you stand up there and we can... So I think... Okay. Thank you. You stand there. I'm going to ask the former minister.
love it.
Minister Moore, you're a health minister in the province of Quebec. Could you help me understand why you are funding only people aged 80 years and over for shingles when the life expectancy in Canada is 88? Could you help me understand, sir?
I was having a discussion with the finance minister, and in that discussion he pointed out that there was going to be a limited amount of funding available, and whilst politically we wanted to make it clear that we were prepared to fund people to avoid shingles, because it's a terrible disease, we realised that we had to find a way to work out what's the best way to make the money go as far as it could. And so we drew the line at 80. So it was not a health decision, it was a financial decision. And then I looked at my colleagues in Australia, and they made a different financial decision. They actually have, right across Australia, they have a shingles vaccine available from 70, but they purchased the Zostavax. And so I actually wondered why it is, and I hope GSK can help me with this, why it is that, that you were successful in beginning a process, and I presume we have 80 and above at the moment, but we'll be working to lower that, of course, when I can get more funds. How did you manage to persuade a government that they were better to use a more expensive, although much more effective, vaccine rather than the cheaper but effective enough vaccine?
I think essentially it comes down to, a quality product, when we're not seeing signs of waning with this product. So it just, I think, justifies the costs and the longevity of the program, really. So I think it's having that, and probably I think we need to do more work, I think, with finance ministers and economic development ministers, so there's more understanding of what you put money into here can really prevent the costs of what is ultimately going to be needed to purchase, for healthcare, at a later date. And I think that truly is a lot of the barrier, is that things are made, decisions are made on a very finite, short-term basis. So.
Thank you very much. Kimberly.
You said when you were showing one of your earlier graphs that vaccine procurement fell dramatically in 2020, when I would have thought it would have gone through the roof. So are you differentiating between GSK vaccines specifically and COVID, or that was confusing?
No, so what happened there is in 2020, there wasn't the COVID vaccines yet. So what ended up happening is because there was so many fewer people, they were told to stay home, they were told not to go anywhere. So people literally just didn't get their vaccines. So, yeah. So the way in which procurement works in Canada is that contracts are made. So there's PSPC does all the contracting in Canada. There's a lower range.
PSPC?
PSPC is basically like public works in Canada, and they procure on behalf of all the provinces. And the contracts that all the companies have with PSPC has a range from like 90. So say you want to buy 100 doses. The range is between 90 doses and 120. So the manufacturer needs to be able to supply 120 doses, but the government can order that lower limit of doses. So that's essentially what is happening there, is governments ordered the very lowest amount of doses, and they also carried those doses in inventory for as long as they possibly could, because it wasn't just 2020 that it was happening, it was 2021, and you know, in Ontario, we actually had a policy win where the government actually extended the shingles program outwards to age 73, because we were trying to explain, like in the 1 in 4 campaign and so on and so forth, all these people had missed so many routine immunizations. So we worked with governments to instill a catch-up program so that people weren't penalized for listening to public health and not going anywhere. So we didn't, so that's why you see that dip. It's that 90% piece that it ended up taking a long time to kind of catch up. So, and I think we still have a significant amount of catch up. If we did that same survey now, it might be 1 in 6, like not even, probably 1 in 5,
Any other questions? Michael?
I'm trying to remember what year GSK recommends what age GSK recommends using shingles.
50. So 50 and above for the general population, and 18 and over for immune compromised, yeah.
The challenge that we have in Canada, Michael, as you know, is the jurisdictional responsibility at a provincial level. So, and that changes from province to province.
Yeah.
So if I move to Prince Edward Island, then I'm not going to be eligible. So it really does, this person and environment really does impact. I want to come back, Catherine, to...
Well, on that very point.
Yes.
It's the opposite in Australia. So the federal government buys and is responsible for the purchase and distribution. No, the states are responsible for the distribution, but it's complex because the federal government is also responsible for GPs and a lot of the...
Right.
So
it's interesting.
But it works quite differently than Canada. Basically, the states are responsible for hospitals,
Right.
in a nutshell, and almost everything else is still federal government response, apart from there's a few things around vaccine, but not much.
Yeah. Did everybody know that Shingles Awareness Week started last year? That's another flag on your calendar.
Yeah.
Shingles Awareness Week in February is the second year. You don't often die from shingles, and correct me if I'm wrong. Yes? So you can die? So let's thank you.
Let me highlight one thing. We know that, I know, I just dropped her message.
Yeah, I had a family emergency, sorry, it's okay.
No worries.
Just relax.
No worries.
By the way, in your absence, Jane just asked whether people can die on shingles. But the complications of shingles, we know that 20 to 30% increased risk on either stroke or myocardial infarction. And this is a well-known fact, but unfortunately it's well hidden under the discussions of the scientific facts. And also we know that diabetes make you prone to shingles, and then shingles make you prone to cardiovascular complications. So for that reason, I wouldn't mind to get a vaccine after the age of 50 rather than 80.
Yeah.
By the way, I'm working for GSK, okay? But my ambition is not to sell anything. Apologies.
I'm not working for GSK.
I had a Zostavax a while back. I just paid quite a lot of money because it's not available in Australia. Zostavax is available in Australia.
Yeah.
Just paid $300 personally for my first dose, and I've got another $300 to go
Yeah.
for other months.
You know, I just want to go back to what Sardar said. My apologies. Sardar said. And it comes back to, you know, your program of advocacy. I always like to think about the enablers of the decade. We've got leadership and capacity. We've got metrics. We have got multi-stakeholder engagement, you know, voice and engagement. So, you know, you could develop your whole advocacy campaign, you know, pulling through there.
Yeah.
But then Sardar has just talked about diabetes are hard to get to the table, but we need them. You know, cardiovascular at the table.
Yeah.
And it really is possible, but we have to be responsible for educating them. And these risk factors, this risk layering,
Yeah.
is the entry point. And I think that could be, you know, I know it's of great importance. My last question before we invite Susan, and then we'll go to Laura, you know, is about the complexity. You know, the first image that you had of all of the, right? So talk to us about the complexity and how that impacts the availability of vaccines.
Honestly, it comes down to redundancy. Like it's doing. I kind of joke, but it's true. It's in Canada, you just do the same thing 13 times, and when you have these federal advisory committees, and then you have to still have provincial advisory committees, and then nobody's listening to what ACIP came out with 6 months ago. And then when you actually look at what the recommendations say, they're pretty darn similar, you know? So there's a lot, and it's time. Like, it's time to patient, right? So that's, I think, the biggest challenge is when you do the same, like it would almost be fine if everyone needed to do their own stuff, but just do it in a timely manner. But it doesn't happen like that. It's, you know, provinces want NACI before they start to conceptualize it. And then they need to do their own stuff, which end up being exactly the same as NACI. But it's just a year and a half later. So it's just, I think those are the biggest challenges in Canada. And I think that's where I think the coalition work will really help, because previously we haven't done a lot of federal advocacy because provinces make the financial decisions essentially. But I think that federal advocacy to whether it's formulating, you know, that ACIP to Medicare coordination, you know, to trigger funding in some way, shape, or form, or legislation of what should be funded by provinces. You know, I think there needs to be just a little bit more federally at the top before it gets really messy, you know?
You know, yeah, look, I don't disagree. I think one of the challenges is that the policy at a provincial level happens at a provincial level.
Yeah.
Doesn't matter what happens here,
Yeah.
it's here. And national advocacy organisations don't operate at a provincial level.
Yeah.
So you really have to dig deep into who are the champions, who are the local associations, what's your strategy, who's your minister, etc., etc.
Yeah.
So I'll be interested to see where you go with PAV and how that operates, because we've got Immunisation Canada.
Yeah.
You know, how do we pull these key organisations in? So
For sure.
thank you,
Immunisation Canada is part of PAV, which is great.
Yes.
Because we still want to utilize all our awesome stakeholder groups, right? We don't want to lose anybody.
No, but we need awesome different ones.
Yeah, we need extras. We need
you know,
extras.
Well, do you know, participation, you know, the action of Canada, you know, that, because this is about healthy ageing. So I think it's about, so we're both on the same
Love it.
page. Thank you very much. Please thank Catherine for her presentation. We truly welcome Susan Weil-Schwartz to the podium. And Susan, you've travelled from New York and representing the Global Coalition on Ageing, who have done a lot of work in the area of adult immunisation. So thank you very much for being with us today.
Thank you so much, Jane, for having us here, and for Laura and Catherine, and for everyone for sticking with us. I know this is like the 90th session on adult immunization, so I'm really thrilled that. I know, and
this is the best session.
and I'm thrilled to see, though, that there is, so much interest in this. I think it just, it goes to show how important of an issue this is, and the fact that there are still people in the room, I think is really excellent. So, hi everyone. As introduced, I'm Susan Weil-Schwartz from the Global Coalition on Aging, and I'm gonna shift gears a little bit from the Canada focus. It'll be a little interlude and take this conversation global. I'm gonna share with you all a few examples of how GCOA is working with partners like CanAge, who will speak soon, and GSK, and a lot of others around the world to try and ensure that we have a policy ecosystem that is supportive of life course immunization. Before I get into that, I want to talk a little bit about why we're here. So not just in this room, but gathered together in Bangkok. Thanks to the innovations and tremendous achievements in technology, in institutions, in systems, across the 20th century, we've reached this really unprecedented moment in time. More and more of us are living longer. There's going to be about 2 billion of us aged 60 or older by mid-century. I'm kind of going to be there myself. But the achievement does not and cannot stop there. The task at hand for so many of us is ensuring that these added years are also productive, fulfilling and active years. And in order to achieve that, we need to achieve healthy longevity. I need to advance my slides. So GCOA is a network of global companies that are acting and thinking differently because of population aging. Together, we recognize the enormous opportunity and the sort of this transformative moment here we have to really move things forward. And along with our members like GSK and member-led initiatives like our Adult Vaccines Working Group, we are actively engaged in the kind of conversations and thought leadership to ensure this policy landscape that can help more and more of us achieve that goal of not just longevity, but healthy longevity. And in this work, we have been guided throughout by this incredible group of individuals that are really inspiring experts in aging from around the world, starting with the late Baroness Sally Greengross, who we learned a lot about the other night and talked about, and I think she's very much here and present at this conference. And then including some younger leaders in aging like Painchi Care's Nini Wang in China and HGPI's Ryoji Noritake in Japan. So before I really get into the specifics of my 3 case studies, I'm going to share a little bit about what we do at GCOA and how it's different and what this looks like for life course immunization, and more specifically for adult vaccines. So if you want to increase the uptake of vaccines among adults, I think most of us will understandably turn to the health system and market gatekeepers, which of course critical, and that makes a lot of sense, of course, because you're not going to get anywhere without that. But we act below the line. If you think of it like an iceberg, we're preparing the landscape in the places and spaces that are perhaps less visible, but that we think are really important to get right first. We focus on telling the story and reframing the narrative and perhaps telling a new or different story and engaging stakeholders and experts from across different sectors all along the way. So this is the big picture perspective. At the 50,000-foot level, this is what we want decision makers to take away from any of the discussions we're having. Healthy aging is an investment. It's not a cost. It's not just spending. It's investing in the systems that allow individuals to be more productive, more active, participate in the workforce for longer, participate in the marketplace for longer, and more confidently contribute to society, and just generally be happier, healthier, and more engaged. And so when considering the cost of the alternative, the investments that we believe to enable healthy aging yield a tremendous return if we are able to shift that thinking from an expense to an investment. And then looking specifically to life course immunization, we're telling the story of vaccines as the enabler that helps us achieve that return on investment in healthy aging that I was just talking about in the last slide. So together with our members and partners and thought leaders, we're reframing this narrative for a policy audience and really positioning adult vaccines as the central amplifier, allowing us to access and more fully realize those benefits of healthy aging, from increased functional ability, improved quality of life, to important system-level benefits like conserving the capacity of our healthcare systems and allowing them to be, to function more sustainably and then ultimately to reduce costs. So that's a quick look at what we're doing from a sort of strategic perspective. I'm going to take you through 3 short examples on the tactical side to show you what this looks like in practice. I'm going to share one example from China, one from Canada, and then some ongoing work of global storytelling. So last year, we partnered with Renmin University in China. I cannot pronounce that correctly for whatever reason. Renmin University of China on the China Healthy Aging Cities Forum, which was aimed to highlight some of the positive policy actions that were taking place in Beijing and China, Chinese and global cities around the world that were supportive of healthy aging. And then in designing this, we intentionally turned to adult immunization generally, and then also some of the COVID-19 vaccination success for older adults in particular as the key examples that we use to want to talk about what cities are doing to support healthy aging. And the forum aimed to directly engage with the municipal government of Beijing as really that key stakeholder, and that was our central audience, really. And it was framed to give them an opportunity to really highlight their leadership in healthy aging and to share some of the best practices and the lessons learned they had from their COVID-19 vaccination experience, and then also sharing expertise and experiences from other participants from around the world. And I gotta advance this one. To that end, along with our partners at Renmin University, we convene leaders from across the globe, both globally from age-friendly cities like New York and from Manchester, England, to the WHO, from GSK, from Johns Hopkins University, and then really critically, we had a large number of Chinese experts in infectious disease, including from the Chinese CDC, who were at the table. I was on the wrong slide, sorry about that, guys. Here's the logo. Okay. So the Healthy Aging Cities Forum was connecting the dots between some of these global platforms like the UN Decade for Healthy Aging, our own high-level forum on the silver economy, and then the China Development Forum's interest in what they call the Revitalizing Aging China. And then against this context, the forum directly led to a report where we outlined some of the policy opportunities for Beijing and other Chinese cities as they were seeking to apply some age-friendly principles to their policies. And then in this roundtable and in the report, we were able to build in several key points of alignment, including with the Beijing government, among all of the participants, but I think, critically with the government, while calling for specific policy actions around increasing access and increasing coverage for vaccines, and then around the need for greater awareness and greater education about vaccines' benefits for older adults. So here's a look at the big picture of what we were able to achieve with this kind of internally focused but cross-sector engagement. First, we put adult vaccines at the center of some of the larger strategic priorities for aging cities like Beijing and other cities around China more broadly. We built this around global expertise from across our network. Third, we directly engaged with and got really the buy-in from the Beijing government, which was, I think, really important for us. And then fourth, we connected sort of the discussion and then the follow-on report and the recommendations through to the global expertise more broadly, specifically to the UN and to the WHO through the linkages we had with the Decade and the Age-Friendly Cities Network. So I'm going to get to the Canadian part. The second example I wanted to share with you all today was this project that we had aimed at engaging caregivers in Canada around the flu vaccine. So before I dive in, I wanted to share the words you may not remember of this very wise woman who I think, though, really articulates well the challenge and the opportunity that was before us as we embarked on this project. Caregivers are really vital healthcare partners. Our healthcare systems, as we know them, would not function without caregivers, and our families wouldn't function without them. They're powerful, but also quite vulnerable themselves, particularly in our current environment, which is rife with misinformation around vaccines. So, in view of that duality, the objective of the project was to increase awareness about flu among caregivers who we really recognize as essential gatekeepers and decision makers for families, as well as vulnerable individuals themselves, and then really move the needle on getting them vaccinated. And what's interesting about caregivers is that while they may have a solid appreciation of the need to get their aging parent vaccinated or their care recipient vaccinated, they were not necessarily doing the same for themselves. They were often too busy caring for others to care for themselves. And I know that for a lot of caregivers for young children and aging parents like myself, that this probably sounds a little bit familiar, and it honestly poses a really big barrier to a lot of things. So as with our Beijing Forum, we wanted to bring together a diverse group of cross-sector expertise around the table and really dig deep and share some insights. And we particularly wanted to ensure that we were centering the voices of caregivers themselves in this conversation about how to reach caregivers, which should seem pretty obvious, but I think we all know isn't always how things get done. And the key insights from this discussion were, again, the calls to actions we had from that discussion were compiled into a report, which we shared with all the stakeholders, and then we released it publicly. And I just wanted to share with you guys a couple of interesting insights that were interesting to me from that discussion and from the report, which is that one of them was that a lot of caregivers don't necessarily see themselves as caregivers. They don't recognize themselves there in that term. And so, sure, they may help their parents out, at night or on the weekends, but they didn't realize that makes them a caregiver. And so the messaging that speaks to caregivers but doesn't really help them see themselves was really missing the mark. I think another insight, which has also been oft discussed this week, was that if a strategy is going to be successful, whether it's in policy or in practice, has to be three-dimensional, and it has to cover that whole spectrum from messaging to the ability to deliver shots to people where they are. And this requires engaging the right people at every level across the ecosystem, including employers, which I'm going to get to or come back to in a couple of minutes. Oops, wrong one. I'll get there in a second. So my computer just froze. Okay, so we had all these tremendous insights, which we released in the report, and we really wanted to take these ideas and share them with the world and start to put them into action. So we created this roadmap to try and think about how we're going to move these ideas out into the public and build a coalition around them and start communicating them for action. To that end, together as a group, we took a lot of the roundtable insights to heart, and we came together to develop a set of materials for a communications campaign ahead of the last flu season that we wanted to speak directly to caregivers across Canada and those who work with caregivers, including healthcare providers, who I think we've discussed are I think probably one of the most important sources of information for individuals, and then also community pharmacists and others who are in spaces where caregivers are. And we developed these materials like these infographics, or this is the first 2 pages of the infographics, in both English and Canadian French. We released them. And then the heart of this campaign was a series of social media cards that aimed to help caregivers, see themselves as caregivers and someone worthy of protecting and prioritizing their own health, for the reasons we just discussed. And also to understand how their health connects to their ability to continue to provide care, which I think for the caregivers themselves is probably the most important piece. And then understand the potential impacts of an influenza infection for them and for their family. And I just wanted to pause because I was sharing with some of you that I shared this slide in English on my Facebook page, and it like blew people away. I think that this is something that people don't know about, and we need to be talking about it all, in all of the places that we are, because it really resonates with people. And then also appreciate the difference between the COVID vaccines and the flu vaccine, why both are important, which was another point that came from the caregiver organizations themselves, that people were coming in and saying, like, I already got my COVID vaccine, I got my booster, I'm over it, do I really need to get my flu vaccine? And then we needed to really be saying unequivocally, yes, yes, and yes. And then know that seeking a flu vaccine can easily fit into your daily routine. It's available in most places in your pharmacy. And again, we created and shared these materials in both English and Canadian French, and shared them with the stakeholder organizations, and they in turn shared them across Canada. I realize those were a little backwards, but. So it's always the goal of this kind of campaign and engagement that it's the beginning. This isn't, the end in and of itself, but hopefully the beginning of something greater. And so our aim, now that we have launched these, is to try and see if we can take some of the learnings and the impact from this initial communications campaign and see if we can build on them, because there are certainly things that we learned. And here are a few of the ways that we see this work continuing to grow, or that we would hope to continue to grow, both in Canada and on a global front. And you'll notice that this also comes back to that earlier point, or the earlier insight about needing to change at every level and across the ecosystem to really bring about successful change. And this includes engaging employers and connecting the dots to that economic big picture that we talked about also in other sessions. So, on that note, the last example I'm going to quickly share before Laura and then sitting down for the conversation is a bit different from the previous two, in that it's not a campaign, it's not a project, but it's rather this part of this ongoing work of trying to sort of strategically reframe the narrative and set the table, if you will, for a policy change on life course immunization. And in this case, we're telling a different story about what life course immunization is all about and why it matters. And we're extending it well beyond the traditional health policy circles. And we're talking to employers and employees and economic decision makers about the workplace of the 21st century. So earlier in the pandemic, GCOA did some research, and we published a paper sharing with employers what we'd learned, which was that COVID-19 had put public health front and center as an issue for the C-suite. And even from the beginning of the pandemic, employees had come to expect that their employers would be more directly engaged in their health and well-being and helping them achieve that. And that was based on some research that, survey research that we had done. And coupled with this dynamic was this historically tight job market you may have heard about, and that raised the stakes for employers to really get employee recruitment and retention right. And this all played out against the backdrop of the mega trend of aging and the impacts that we all know that that's having in the workplace in terms of more adults working longer, the new 5-generation workplace, emerging data on the productivity gains of retaining older workers longer, and then the caregiving crunch, which includes not just employees who are caregivers, but also the grandparents at home caring for their grandchildren and allowing their adult children to continue working. So that's a lot. So what did we do? We placed adult vaccination at the center of all of this. So we're framing this narrative and putting adult vaccination at the center of the future of work through roundtable engagements and conversations, blog posts, social media, and traditional media, all aligned to high-profile platforms like the OECD Forum, the World Economic Forum, and our high-level forum on the silver economy. We're helping to lend credibility and reach to this kind of framing. And this is an ongoing effort that's helping us tell this new and bigger story about adult vaccines. So ultimately, for GCOA and our members and our partners, we believe that highlighting the direct linkages between adult immunization and the economic pieces, so fiscal sustainability of our health systems and economic growth, that this is one of the most powerful strategies we have towards moving the policy landscape to move the needle. So thank you very much.
Welcome, Laura. Laura Tamlin-Watts, our founder and president of CanAge. Thank you.
I think it's so interesting that we think about caregiving as part of this conversation, because my 86-year-old mother just had a fall, and my 22-year-old eldest trans child has just had surgery, and all of them decided to call right now. Does this seem familiar to anybody else in the room? Yes. So I just think it was really funny. So if you've got it, oh, you want to do it on that? If you could just put, you want to hook it in? Okay. All right, well, we'll figure it out. All right, we'll start there for a second. I just want to introduce the framework that we're talking about, which was really what, so what, and now what. So we actually didn't feed Jane that question. The what was from, as we often are relying on our medical staff. Oh, magic finger, and the good finger, not the bad finger. There we go. There we go. Thank you. We wanted to talk about what's the evidence, what's the interest, what's the concern. And then we wanted to talk about, what is it that we can do in terms of strategic initiatives together? I run an advocacy organization, so the kind of now what piece flows in this direction, although it is iterative, of course, that I think it's really important that we're working together. When we're talking about what we can do in this, we often get down to that, yeah, but I didn't go to school to be a marketer, or I have this important message, but why is no one running to change their policies, right? And so part of what our organization does is work on a collegial basis. And I think that's really important to know, because the old narratives of civil society somewhere over here yelling into the wind, right? Policymakers and governments are over here with their heads down, and we have industry somewhere over there trying to run a business because that's what industry does. And I think those old dogmatic narratives just need to come to an end. If they have not yet come to an end, they need to come to an end shortly. So one of the things that we wanted to do at CanAge was to take the what and the so what and actually try to create both a bit of a school for people to actually do that change at the level. And one of the ways that we've done that is through creating a vaccine report card. And actually, we're launching it today. So this is the big news. I know for us, it's a big deal. It may not rock your worlds, but it's very important for us. And so we've done vaccine report cards for the last 2 years. And when we're talking about what a vaccine report card is, this is very exciting, we wanted to get past that obfuscation of, I think we're doing a good job in our jurisdiction. Or it's not that important. Well, we know that it's important. We know why it's important. We know that it's cheaper to do preventive health. Like, these are not unknown issues, right? We know that. But fundamentally, how do you get that issue from, kind of interesting, not urgent, into the quadrant where you have to take that action now, and that it is both pressing and important? And how do you actually functionally do that? We don't actually teach that, do we? It's not a thing that you go to often in school. You end up in our area, whether or not you're here because you're in a passion area, you're here because you are good at your particular job, but rarely do they actually teach you the mechanics of how to make the specific change. And so when we're looking at our vaccine report card, you'll see that we used and implemented a couple of techniques. One of them was, we used a lot of pictures. And I mean, we used a lot of pictures. That sounds silly, but in the end, if you're ever going to be showing what people are, I don't know about you, I do read those 100-page documents, but you gotta find some time to actually be able to do that. When you're thinking about what it is you need to do in terms of the techniques of pivoting, you also have to think about who the people are, really focus on who those people are and what their agendas are. And again, really happy to share the slides with you as well. So our organization has pinned some of these issues to particular days. That's the first thing I wanted to talk about. There's a technique. So for us, National Seniors Day, and of course, International Day of the Older Person is October 1st. It's never had anything to do with vaccinations. It doesn't have anything to do with vaccinations. It's usually politicians making nice gestures by going to a local community center, having a nice lunch, tea and cakes, whatever it is, nice photo opportunity, maybe talking about how much money that they have already invested and how they care about older people, right? Sound familiar? Gets you nowhere. Okay, and so part of what we wanted to do was work with organizations like the IFA and our colleagues to pin a day that already existed and layer another urgent issue on top of it. So October 1st, every year for us, isn't just National Seniors Day, we also make sure that we bring a vaccine focus to it. And we launch kind of influenza. When we're talking about influenza, we also talk about shingles. Shingles and influenza don't really have anything to do with each other, except that they do because they affect older people, right? So these are the techniques of taking a pillar day and then winding these particular pieces to it. It's really an effective way of doing it. We created a policy book, and you'll see that the I in this is infection prevention and disaster response. So here's another technique. Make it urgent. We didn't stick it under health. Oh, it's under health too. If you go some digging around, you'll see that there's stuff under health. But it's under disaster response, right? All of a sudden, you've been creating in your narrative a sense of urgency around that, and that's really important. So if you kind of open up the accordion, you'll see that there's particular issues that we have there, and then you would be able to double click, and you take the evidence that we got from our colleagues, the what, we take the relationships and the formulation and the great strategic tools that our other colleagues have created, and then we put it in a framework where people can actually walk into a meeting, a house of government, a Congress, a committee meeting, and we'll have people actually tapping on these, and they open up to very specific evidence-based issues, because you need to come with solutions, not problems. There's lots of problems. What can that one policymaker do today? What's the one thing that we can move that will drive it up? So we had, I will call it gently, a miasma, a cloud, an obfuscation of information about adult vaccinations. We have, like so many other countries in this world, many different jurisdictions with different finger-pointing abilities. It's not my job, it's the other government's job, it's not my job, it's this other government's job, maybe it's someone else, right? It's always someone else's job. And so we took the idea of a report card, taking only the government's information. Now that is part of the what, so what, now what strategy. And I was sharing over lunch a funny thing that we had happened in our very first report card. Governments were getting this information a couple days ahead of time. It was going to hit the headlines. I got a call, very angry call, from the chief medical officer of health from an important jurisdiction. And he got on the phone and just ripped my ear off. First of all, I'd never met this man before, right? So it was like, hello, hi, how are you? Are you Laura? Yes. You know, can I help you? And then just went on a tirade because he saw how his jurisdiction scored very badly, right? He wasn't calling to say thank you. And then he demanded, as we all do when you want to attack someone, you attack the methods, right? Wherever possible, you attack the methods. And he wanted to know where we got these methods from. And I had great glee in saying, you, right? We were able to cite the material that he had actually created. I didn't know why he didn't look at the footnote, but he was so incensed to see that they got such a bad grade that he reached out. Was I upset about that? No, I was thrilled about that, because it went from something that wasn't very important or timely or urgent to him picking up the phone and yelling at me. And then when I pointed out that this was all their information, and here's the citations, he said, I'll be in communication with you later, and issued a press release. And the Minister of Health had to get up ready the next day to say what their jurisdiction was going to do about their unbelievably bad failing grade. What, so what, now what? So it's an important technique. So what we did was we just took funding, access, and awareness as our ways of looking at this. This is the report card as an example of what it looks like. And it was important to give crisp and clean messages, right? And it wasn't a blame, because face is really important in our country. Face is really important. So I'm not going to go and say you're doing a terrible job and we hate you for it and so on. We'll say here are the areas, and like a good report card, here are areas of improvement, and here's how we and others can help you move from the average was a D minus, not a good grade. That's a failing grade in Canada, but we can help you. And so giving some synthesis, and we wanted to see like also what spotlights so we have. So just our first year, we did a spotlight in Indigenous Canadians. That was very, very important for us because we have extremely poor health and extremely poor vaccinated health, but also just generally the conditions of social wealth and distribution aren't so good. The second year, unsurprisingly, we did COVID. The next year, the one that we're releasing today, is going to have a spotlight on RSV. Very, very excited about RSV and the vaccines associated with it. So this is what it looked like. It was a 2-page fold-out for every jurisdiction. So the methodological geeks, right, could look at this. And when we also made it with an audience toward journalists. So our media strategy was really, really important. Because getting from that not that important and not that urgent right up to top of the line, using media as a very strong arm and a trusted source, not histrionically, but pointedly telling the story, and then working with our local community-based organizations so they had someone to interview. Because you know what? They always want to talk to an old person, right? Okay, so we got lots of old people in our great, you want to talk to an old person? Sure. How old? What color? Where? Living where? How? Sure. Okay. Is there a disability, heart condition? Let us know what you need. Another part of it was to have a ready speakers bureau. And that's, I think, a piece that lots of folks forget to do. Because when media calls, it's 15 minutes from now. Maybe you get a day. That's unlikely. And so I need to call, Bob, Sue, Lynn, Atto immediately and say, you're up. Are you good? Yes. Okay. So doing that pre-work to make sure you have a speakers bureau, we have found to be very, very important. And then we got, fancy people to say the same thing. That was important as well. Everyone has thought leaders in their field. We got them involved. And so when we're looking at kind of how we explained this, we did that cross-pollination piece as well. So it wasn't just about these vaccines that we were measuring. So we were measuring shingles, which in Canada is a mix of coverage, not unlike many other jurisdictions. Flu, again, a mix of coverage, but more advanced in some areas. It's been around longer. And pneumonia, people have no idea that there's a vaccine for pneumonia, let alone which one they might have taken. And then we did this sort of MMR and Tdap and those types of things as well. So we tried to show, yes, there's the WHO position. Yes, we've got different vaccine recommendations. All of these things are good. Yep. Yeah, I know. And so we wanted to actually put it into, this idea of how do you teach people to do this effectively? In our first year of our report card, we had $151 million worth of earned media. It's a lot, $151 million of earned media. It didn't just go across Canada. It went to the States. It was in the Wall Street Journal. It was in the New York Times. It was in Europe. We ended up in weird places. Bulgaria ran a thing on it. I have no idea why. And I think what's important is people are looking for something that they can understand, right? That they can explain and then use. So we end up talking about this difference between policy and marketing and communications and so on. When we're trying to teach it, we try to say, look, yes, the advocacy is this piece that goes between the what and the so what, and then this is the now what. This is how do we bring it together. And so we're also preparing people for that community engagement. Again, a piece that I think a lot of folks miss. So how do you develop this framework? What's the success? What's the recipe? So we ended up actually running teaching protocols, not just for vaccines, but other things as well. And these were them. So how do you actually do it? How do you take your what and your so what at a functional level and drive it with media engagement, with getting changes to government, with doing what I still think is my favorite story, which was having one of our jurisdictions print out the report, staple it physically to the request for Treasury budget, and walk it over and put it down on the Minister of Finance's desk and say, we got F, F, and D minus. If we do these things, and they're written out for us, really easy, these 3 recommendations, we can be a leader in Canada. And they jumped hugely. Well, what that means is if it's a smaller jurisdiction or a more, complicated jurisdiction, then the big easy ones get really embarrassed. So we use this sort of side-by-side measurement to say, helping your narratives, if they can do it, why can't you? So we talk about make sure that you have all of this information ready, make sure that you are in there. If you're going to release a report, you better have all of these things prepared as it. One of the things that drives us crazy is when people say, like, this is a big problem. We're like, yeah, this is a big problem. So's lack of housing. So's climate change. So's, right? What is the one thing that you want to have done? And in our report, we specifically gave 3 key action areas for each specific jurisdiction that if they did, their grade would go up. It was as easy as that. And what we have seen, happily, is mostly if you make it really easy for people to win, and it's not going to cost that much money, and they can get up and say, yes, well, we understand what the issue is, and we've taken these steps, they'll change. We are able to track that we had 12 different coverage changes in the last 2.5 years. Now, is it only because of the reports? Absolutely not. No, it's because of the incredible work that the whole group does. It's because those voices that are ready. It's, yes, you need all of those things. So is this the only thing? No. But it is one easy tool that the policymakers can take the what and the so what and do the now what and explain it to people and do it in a way that gets a lot of coverage. So we started teaching about how you do it. And this is the Ratchet formula that we developed. This is not even an elevator speech. This is the escalator speech. Like, if you should be able to do this in the amount of time it takes to get on with your shopping cart and then get up to the top, right? This is what it is. Start. And what we started telling people who were also advocating in this area, for the love of all that you find holy, stop talking about your own organization. Nobody cares. If you're interesting, they'll ask you about who you are at the end more because they want to actually do something. How many organizations or meetings where you've been in that tell you how many people they represent, how much money they have, how many years have they been working together? No, I'm here because this is the ask. This is the what, this is the so what, this is the cost, this is why we want to do it. And this started becoming a very useful way that we started teaching advocacy and public policy with this. And again, really happy to share the slide deck as well. The storytelling and the making it personal is critical, we know that. But don't let them go off about their darn mother-in-law who got the flu or who got shingles, and to the point where you're eating up your 20-minute meeting. When you get them, you say, have you ever had shingles or know somebody that has? Have you ever had the flu or know somebody that's had? Did you ever have pneumonia? Oh, yes. Then you get them to tell you back how bad that was. Then you say, did you know this other thing and it's not covered? Do not let them wander into the personal conversation, because that's what we call motherhood and apple pie. It's unfortunate, but it's not now driving it to urgent and problematic. What they are doing is reflecting on how annoying it is and how they don't want to have shingles in their eyeballs or whatever it is again. Yeah, okay, that's great, it's terrible. You know what? Your mother has the same problem as 3 other million moms that are in that job. And if we made this one change, none of that have to happen. And how old are you? I'm 52. Did you know that you're supposed to have it at? Make it personal. So away from just the mother, back to them. And then, then we don't like that. So, when we're talking about how do we make sure we do it, the idea that the minister or the head of government or whatever is the most important person is the first idea you need to get rid of. No, the most important person is the person who makes the appointments. That is actually the most important person in government. It is, we used to call them secretaries, administrative assistants, booking agencies, I don't care, whatever they are, whoever makes the appointment has the power. Be nice. Be helpful to them. And then you understand that it's probably not the elected officials, it's the civil servants that are going to make a job, whether it's in one organization or another, one country or another, it's the machinery. What goes in front of the political person, yeah, it matters to make that appointment, but in the end, I don't need my baby's kiss and my handshake. What I need is the policy change. So making sure that when you're doing it, that you've got the right rapport with the right people, and make sure that when you're doing your meetings and timings that it matters in their cycle. So if I am ordering a particular kind of vaccine, don't tell me about it at the wrong time. If you're ordering a vaccine that gets ordered in April, don't tell me about it in May, because I've already missed my window. Start talking to me about it in my budget cycle. Make sure that you have a good understanding of what those processes are. And in vaccines, one of the hard things is they don't buy things at the same time, right? So you have to be thinking, if you're going to be talking about shingles, it's a different kind of thing than if you're talking about flu, right? How are they being made, but also how are they being bought? So being really pragmatic about that is critically important, because if you get there and you're at the wrong time, it doesn't matter. Absolutely. So the last thing I wanted to say was, this is how, you should have a package with you. And that's why the vaccine report card was so important, because it all was sitting there in it together. And that not only was I about to wrap up, I was finishing the last slide. So today is going to be the launch of the 2023 vaccine report card. We're very excited about it. Again, looking forward to new information, RSVs on the horizon. We think that's critically important. And so what we three wanted to do together was talk about how you take the what and the best information, some of it's technical and scary, work together with organizations and societies, and then help to support often community-based organizations who don't necessarily have a lot of sophistication and advocacy, and try to make it work. Thanks very much.
Terrific. Thank you very much. I am going to take a couple of questions from the floor. I know it's freezing in here. And yes, it is freezing. And I know it's 5 o'clock. But let's just take a couple of questions, and then we'll wrap up. So, Laura, you terrify me. So I'm a minister. I'm the secretary. I guess my question is about communication and how you temper your communication and your messages to different audiences to get them to respond to you. So you're formidable in any scenario, but I've seen you use very different strategies. So can you just describe a different strategy?
One of the things I do when we're teaching community-based organizations how to make a pitch, and again, we think that the vaccines are what we want to be talking about, but it doesn't actually matter. You can change it to whatever you want. Part of what we put them through is, what are the political leanings or what are the messages? No, it sounds obvious, but it actually takes some work. So if they're in power, we look at whatever statements that they've said. What are their mandates? What are their keywords? It's easier if they're in power because they probably got it written down somewhere. If they don't, make some calls. They're supposed to answer you. If they're not in power, look at all of their past statements. And again, this is work that most people don't realize is available in most countries somewhere. In some countries it's very easy. Australia, Canada, less easy in the States actually, I find. There's a lot of information. It's harder to collide it together. If you're in civil government organizations, again, it's pretty easy. But find their words, use their words, pitch it to their words. It's the same ask, but make sure that you're curating it so that the win is there for them and they get to win in the way that makes sense to them. And then what we try to do is embed it in each of their policy platforms.
Okay. Thank you very much. Yes.
We we say, particularly if you're going to a politician, read their inaugural speech, maiden speech, whatever you call it. It's always there, easy on a website.
Okay.
And it says why they went into politics. They may have got cynical, they may have gone past that stage, but you get a really good insight into what the driver is.
Okay,
Yeah.
thank you. Susan, I'm coming back to you because as with GCOA and CanAge and IFA, one of our deliverables is often a technical report and often knowledge assets and often... So talk with me about how we can use those multiple reports that are lying on our desktop somewhere, and we've all got them. And I think we need to be smarter and better with what we've already done. So any thoughts about that?
I mean, I think that's a really good point because there are certain reports that do get released and then live on our desktops and then live in. But you know, and that's just a fact of life. But I think that I can also recognize that the different reports function in different ways. So we, you know, for example, we release reports like the report card that that you guys have released. We have several of those that serve a particular function, which is to make people uncomfortable or to get them to light a little fire under them, to get them to move things forward. And that's an actual, like, real tactical report to push that over there. Other reports that we do are really about the process of putting out the report to create an opportunity for media or a vehicle to talk about it or something to bring somewhere to someone. And sometimes it's also just really the act of bringing people together to have those conversations if it's about the right people. So for example, the Beijing report that we created, I don't know that it's gonna have a life beyond that thing, but it allowed us to come together into the room with, or the Zoom room rather, with members of the government from Beijing to have these conversations on the record. And so that there's different roles and different, so I think that.
Understand, you might see outside a big board that says Global Atlas for Adult Vaccination, because we believe there is sufficient evidence to make change, but it's sitting on all of our desktops. And if we pull it together and understand how to action it, then that's a different way of looking at it. So I'm all for churning out reports. However, I think we really need to actually move into the action. So we've clicked past 5 o'clock. It's been a long day. However, what we do in the sessions that I moderate is I go back to the speakers and say, what's your one takeaway message that you want us to take with you? So I'm going to go backwards. Laura, Susan, Catherine.
You have to have the what, the so what, and the now what. And for the now what, you have to teach community-based organizations how to do technical advocacy. It's really critically important that they have the skills to do it. It's not that hard.
It's hard. Susan.
I think for us right now on vaccines is really the realization that moving things forward on vaccines isn't necessarily talking to health, but it's talking to all of the other people in the room. So it's talking to the caregivers, it's talking to Ministry of Finance, and it's talking to all of the other stakeholders that may not realize they're stakeholders.
Thanks, Susan. Catherine.
I would echo that and say it's a collaborative voice. It's a collective voice that is really going to move change. It's not ever one organization having a meeting and then 2 months later having another meeting. It's the collective effort of all kinds of people going in with maybe not the same message but aligned messaging that is moving policy change for patient wins, essentially. So it's collaboration, for sure.
Okay. Look, we thank GSK this afternoon because they have sponsored this symposium, so join with me. What's been very impressive to me is that our industry colleagues have been in the room, and that is actually very meaningful because they're, Serda, Catherine, you're actually hearing firsthand that we have lots of intelligence. We're not the civil society that just sits and just waits for funds. We actually use little bits of funds to make big things happen. So it's really impressive, and it's happened in every, symposium that I've been in. The second thing is that industry are colleagues, they're partners, they're collaborators. And, in every situation, they sit at the table just like government, non-government, academic. Quite frankly, off the record, I'd much prefer to work with industry than with government because I know where I stand, right? And I think that's very important. So, sorry, what was that? What was that, Michael? No, they don't go for election, no. So once again, day 2 is finished. Thank you very much for really creating this environment where there are opportunities to join together and change. Okay, thank you. Have a good night tonight.